Welcome to your 4-minute paediatric cannulation video. So top tips on preparing the child include distraction techniques, explaining to an appropriately aged child before you start heading towards them, enlisting parental support both in keeping the child calm and positioning them well, and thinking about age-appropriate analgesia or anaesthetic ahead of cannulation or phlebotomy. Equally crucial is preparing your kit and doing so away from the child to reduce their fear. Liaise with your assistant away from the child and have everything out of the packets primed and easy to reach for. Pause the video now to see all the kit you'll need for cannulation. For most children with non-time critical cannulation needs, using a cream such as Amitop is the best way to numb the skin prior to the procedure. And a top tip for scared children is to put a blob of cream onto the sticker rather than onto their hand, and then place the sticker onto their skin as shown. Apply cream to both hands and antecubital fossas, and then take your time after the 45-minute cook time to choose the best spot. If the child is older or less fearful, or if the phlebotomy or cannulation is more time critical, then using cryogesic cold spray is a good and rapid alternative. Positioning is crucial for your success, and tucking an arm under a parent's arm while they have a cuddle can be very helpful. In a younger child, say under the age of 6, you'll probably use your assistant to be the tourniquet further up the limb and to hold the hand still. But in an older and hopefully cooperative patient, using a tourniquet as you would on an adult is a reasonable way forward. Once you get blood flashback, don't forget to advance the needle just a couple more millimetres to make sure the cannula itself sits within the vein. Advance the cannula, assuming it's easy to do so, and then what I tend to do is secure the cannula down just with one piece of tape to allow me to then tinker with it slightly as I take blood. You may find you need to pull back just a millimetre or so, or change the position of the child's hand to allow you to then take blood from the port. It's important in young children to attach an octopus so that nurses can access the cannula without too much distress. You will have primed this with saline before going to the child, and once it's tightly screwed in, check that the cannula is working by flushing with a small amount of fluid at low pressure through a small syringe. Then complete applying your dressing, securing it down neatly, getting rid of any blood, and then carefully wrap up in a bandage to hide the cannula from view. Remember to use a capillary tube rather than an adult venous blood gas bottle if you do not have much blood. You can fill the capillary tube directly from the cannula port, or you can carefully inject it from your syringe downwards into the capillary tube. Your single blood culture bottle must be sterilised before injecting 1 to 3 mils and then putting the patient's sticker over the patient identifier line on the side of the bottle. And remember, it's technically trickier than adult cannulation. Please seek senior supervision for your first few, especially in the under 5s. And if you've had 2 unsuccessful tries, then please ask for senior help rather than persevering.